Welcome to today's press conference. With us today are three doctors: Dr. Edwin Chui, Controller, Center for Health Protection; Dr. Chong Sok Kwan, Head of Communicable Disease Branch; and Mr. Larry Lee, Chief Manager, Hospital Authority. Dr. Chui, please. Fellow citizens, friends of the media, looking at today's figures, the number has been increasing. 614 cases have been confirmed. From yesterday, there are well over 600 suspected cases. Most of the cases arose from the festive gatherings. The situation is not optimistic for now, but I hope that members of the public would cooperate with us, minimize mixing, minimize going out, stay at home in order to strengthen the social distancing measures. Our contact tracing work is going on. Our containment measures still going on. We have the capacity to keep on top of the pandemic, but we still need to have time, in particular when the cases are rising. I'd like to urge the members of the public to get the jab and also to observe personal and hand hygiene. Wear your masks properly, in particular in crowded places. The number of cases has been rising. The number of beds in the HA is becoming really tight. We are embarking on the Penny's Bay quarantine facilities, and we're going to be having the stay home safe isolation program. Dr. Lee. Right now, Penny's Bay community isolation facilities. We are arranging for patients to go to Penny's Bay, and we will be receiving the low-risk patients. We have to have regard to factors like whether they have any symptoms, whether they have mild symptoms, whether they are young with a good management capacity, and whether they have been inoculated. The HA, the DH, and various departments are co-managing the facilities. We will be sending teams to provide 24-hour medical support. If there are emergency situations, we will arrange for the patients to be sent to the hospitals. All the arrangements will be predicated on risk basis, and with this arrangement, hospitals can provide the services for patients that are suffering from more serious conditions. On behalf of the HA, I'd like to announce some figures. As of 9 a.m. over the past 24 hours, our system has recorded 442 cases. 116 patients have been discharged, totaling 13,232 who have been discharged. There are 1,668 patients who are being treated at North Lantau Hospital Infection Control Center, the HA Infectious Disease Center, and AWE facility. There are two in critical condition: a 77-year-old 13400, 84-year-old male patient 14814. Another patient, a 78-year-old male in serious condition 15118. Also, I'd like to report that there are a number of colleagues who are preliminarily positive because of community and home contacts. There are one Tin Mun hospital doctor. There are 8 medical workers in QEH and various other hospitals, and there are HCA and clerical staff who are in PWH Caritas Medical Center, Yan Chai Hospital. They're working there. They have been arranged to be put in isolation, and we are starting the contact tracing. In the course of work, they did wear proper PPE, and none of the patients are listed as close contacts. But some staff members did have meals without a mask on. There are 20 or so close contacts that have to be quarantined. All these close contacts are or tested negative. So we urge people not to have meals together and observe social distancing. As to patient screening, there are 5 patients who are preliminary positive, Tuen Mun Hospital, Pok Oi, Prince of Wales, and QEH. There are 2 colleagues and 1 part-time nurse who didn't wear the goggles, and they were regarded as close contact. There are 10 patients who are listed as close contacts. I'd like to urge my colleagues to be vigilant and to put on the proper PPE. For A&E departments, I'd like to make some pleas here at the present moment. At the CTC, if a test has been undertaken, if they have received an SMS showing positive, they should wait at home, put on the mask, and wait at home, and don't panic. The DH and the HA will arrange for them to go into the hospital. And for people who have undergone the RAT test, and if they test positive, I'd like to make a plea here. The key thing is they have to undergo another confirmation test. And this is somewhat different from the CTC arrangement. If there are family members or friends who can render assistance and arrange for a deep throat saliva test for them, they can stay at home and undergo the test. Now, should this not be a possibility, we urge the patients to go to the A&E in the quickest way, and we will arrange for them to go to the outdoor triage station to undergo tests. If they don't have the symptoms, they can go home and wait for the result. If they are symptomatic, there will be a suitable arrangement for them. Also, there are some serious cases arising. So if you haven't got the jab, please go get the jab. If you have got 2 shots, please go get the booster, get boosted yourself, because this will minimize the risk. Thank you.
Thank you, Dr. Lee. In respect of what Doctor said, that is tomorrow we'll be commissioning the community isolation facilities at Penny Bay. In other words, some of the location at Penny Bay will be used for isolation purpose. Starting tomorrow, we will also be start to have the Stay Home Safe program, and some of the cases can be quarantined at home. We are going to have a 4-day quarantine period for the close contacts and the family members of close contacts, and there will also be a 14-day quarantine period. As before, we have identified first these close contacts through contact tracing. We will then decide whether or not they are suitable for household quarantine or isolation. We will that would include looking at the household environment of the patient, whether or not he is using the kitchen and other facilities with other people in the same premises, and also whether his or her family members have gone through the 4-day and 14-day quarantine requirement. For those people who require special assistance, they will still need to be taken to the quarantine center for quarantine. Our colleagues will contact such patients. The AMS will provide them, deliver an information kit reminding them of the things that he should pay attention to during the 14-day quarantine period, and that he should take the test on specified days. And he should also, take such tests, as stipulated. We will also provide them with information kit, and if he has any question, they can call our hotline for assistance. Most importantly, we hope that the citizen, during the household quarantine, they should, take periodic tests and monitor their own physical condition. If they feel unwell, or if they are tested positive, they should let us know immediately. We will arrange for them to be taken to the hospital for immediate inspection and treatment. As for the information kit, Other than the information kit, we also have our colleagues going to the home of the case concerned and to help him put on, a risk ban. So staying home safe require members of the public to cooperate and to exercise self-discipline, refrain from going out, conduct, periodic tests and monitor their own physical conditions. Secondly, we also hope that the property manager of buildings would also cooperate with us and help those people who are under quarantine in the building and to ensure that the environment of the building concerned is clean and disinfected periodically. Thirdly, for those people who are subject to quarantine, household support is very important. We hope that in the event of this incident, people who are subject to quarantine, their relatives and families and also couriers will work with us closely so that the necessary resources can be dispatched to those people who are under household quarantine. Perhaps I'll pause here and Dr. Chuan will tell us about the number of cases today. Good afternoon. We confirmed 614 positive cases last night. At the moment, we have about 600 preliminary positive cases. Of the 614 cases, 7 are imported cases. We have 31 local cases bearing the L452R virus. The others would be the Omicron strain. Up to now, 150 cases have been identified. The other cases are still under investigation. Yesterday, we had, of the 242 cases, 219 of them are untraceable so far. Most of the cases are linked to inter-family gatherings before and after the Chinese New Year. We also have some cases which are untraceable at the moment. They include salespeople or cleaners, security workers, and also construction site workers. This could be due to the fact that they've taken the test. Starting from today, our daily, we will stop, dispatching the details of individual cases which have been confirmed. If there are new buildings which need to be subject to quarantine, we will make an announcement as soon as possible. For some of the buildings, we need to conduct an investigation to see whether there is any lateral or vertical transmission, including the Cayenne House of Nam Tin Estate, Hin Tat House of On Tat Estate, Luk Lau House of So Oak Estate, Leung Kit House of Leung King Estate in Tuen Mun. There were more cases emerging in Leung Hing House last night, and we are looking into whether or not there is any vertical or horizontal transmission. And Block 9 of Chin Shui Wai Chun Wang Hin. We'll look into these cases. In Tokawang, the recreation center there is one resident who has been confirmed. So there some other elderly residents there will also need to be quarantined. So it's now Q&A time. Please tell us the organization you represent before you put your question. The lady in the middle, the last row. Good afternoon, I'm from Now TV. For the Hong Lok Yuen elderly care home, you have one resident who has been confirmed positive. I heard that the residents living in the other wing will also need to be quarantined. How many such residents are there altogether? In Making House of May Tin Estate and May Kay House, you have respectively, you have in total about 22 preliminary confirmed cases. In May Sao House, the residents can leave the premises, but although there are 5 confirmed cases in that building. What is the criteria in determining whether you or not you extend the quarantine period by 1 day? Do you suspect that there is vertical transmission in the same building? the number of cases has now gone up from 300 something to 600 something. How would you describe the situation? Are we seeing, an explosion of the cases? The HA was saying that some of the nurses had removed the mask and as a result became infected, and it involved about 20 odd people. So which hospital are we talking about? And are they mostly nurses, or what rank do they have? For household, quarantine, there is also a risk involved. We heard that there could be a positive case. Let's say if there's a positive case, and for couriers companies, you hope that they can also cooperate with the government. Are you worried that this might actually cause another wave of transmission and causing transmission in the same building? I'll answer the question regarding the number of cases first. In the past few days, the number of cases has been rising steadily. Yesterday, Dr. Zhang told you that we had about 200 odd cases. The number has jumped to 600 today. So the situation is not optimistic. But most of these cases actually arose because of the gatherings which took place during the Chinese New Year. Because for Delta and Omicron strains, there is an incubation period. So if you have gatherings during the public holiday, we can expect more cases to arise. Although we now see an increase in number of cases, in Hong Kong, however, we are still conducting a proactive, policy to curb the epidemic, and we are trying our best to minimize, social gathering so that we can actually curb the spread of the disease. Although the number of cases has almost doubled since yesterday, I hope the general public would really work with us. And if it is not necessary, please refrain from going out and attending gatherings, because if you continue with such gatherings, the epidemic will not stop. But if we all work together, minimize going out and minimize social gathering, hopefully starting from today, we can gradually actually suppress the spread of the disease. Furthermore, there's a lot of contact tracing and segregation work that needs to be done. We hope the public will work with us. Together with our efforts, we hope we will be able to contain this wave of the epidemic. As for the home quarantine program, compared with our other community, quarantine facilities, the risk is slightly higher. But how can we do our best to minimize the risk? Now, first of all, we hope the public will cooperate with us, that they stop going out if you are under household quarantine. Even if you don't go out, there will still be some household activities. For example, such people may require delivery of food stuff. We hope that the property managers and the courier companies will work with us. We think that the risk is relatively not that high. We have this guideline that is for the delivery or courier companies. They will actually conduct non-contact sort of delivery. As in the case of the quarantine hotels, when they deliver meals, they will have no direct contact with those people subject to quarantine. If we could have non-face-to-face contact and no cash exchange in the transaction, and informing the person beforehand about the delivery, and place the item outside the door of the premises, and inform the person inside that the product has arrived, so that they can quickly open the door and take delivery, then the risk of transmission would be minimal. Of course, when they open and close the door, we would require the person under quarantine to wear a proper mask. And another point is that some people may still need to go out of the premises. For example, they may need to leave the premises to dispose of the garbage. If such people under house quarantine would need to dispose of the garbage, I think we have to ensure that they have taken the rapid antigen test and proven to be tested negative. When they leave the premises, they should close the door and return to the premises as soon as possible. The garbage should be wrapped up properly. So other than the government, cooperation and self-discipline on the part of the public is also very important. Of course, if we have quarantined persons in the building, we hope that the property manager especially in the midst of the epidemic, which is so severe at the moment, they should actually conduct proper cleansing and disinfection of the premises so that we can, effectively, control the epidemic.
And starting from tomorrow, these home isolation people, they're not confirmed cases. If we have preliminary positive cases, we will notify our colleagues to send the relevant people to the hospital for examination. In many buildings, we do place them on lockdown for testing, and release a similar arrangement to this. And I hope that with these measures we can minimize the risk. I defer to Dr. Chuang. Meiji House, Making House, there are well over 10 cases each. There are some units where there are some gatherings, so we are going down there to have a look to see whether there are any horizontal transmission. Maysow House, the cases are more scattered. The situation is not particularly bad, although transmissions are taking place there. So that's the current situation at the moment there. Dr. Lee? Right, the elderly home, there are 50 or so elderly people who have to be evacuated. Dr. Lee, I mentioned 20 colleagues who are listed as close contacts. They had meals together with their mask off, and they in 4 hospitals, QEH, PWH, Yanchai, and Caritas Medical Center. Mostly they are in QEH. They are nurses. Next, please. Gentleman over there.
CMP. First of all, since there are over 600 cases today, Hong Kong's COVID-19 defense is starting to collapse. And secondly, about the Penny's Bay, how many units in Penny's Bay will be open tomorrow, and how many beds will be provided, and how will the HA choose patients? And also, we know that there were only 3,000 beds prepared for patients in the hospital, infection control center, and Asia Road Expo. What is the occupancy in each facility? And lastly, we heard from the union leaders that 2 more cross-border truck drivers supplying vegetables have tested positive earlier. So, and some 20 trucks, mainly supplying vegetables, cannot cross over to Hong Kong lately. So, does the CHP has such information? Thank you.
Okay, so maybe I'll ask Dr. Lee to respond to the arrangement of the hospital authority, and Dr. Zhang to respond to the case.
Okay, I think I firstly answer about the Penny Bay Isolation Center. I think as an initiative for the phase 1, we will operate around 600 unit rooms in Penny Bay. And actually we'll try to shift the patients, like I mentioned before, that will be young, fit. We will consider the vaccination status, any major medical background, and also we will see any whether the patients the VOC status. So we will make some consideration, and then we try to download cases to there. And as for the your last questions about the occupancy, I would like to report that the isolation bed now occupied is 1,184, which is an equivalent to 81.3%. And now for the isolation room is 655, which is around 85%.
So about your questions of the Penny Space community isolation facilities. So starting from tomorrow, there will be 600 units to be allocated to these isolation facilities, and it is in the phase 1 of the Penny's Bay. Yeah. So we will continue to allocate the next phase, like phase 2 and phase 3 and phase 4, to be used as a community isolation facilities when there's in need. So, Dr. Zhang, please.
We did receive some cross-boundary truck driver either confirmed in mainland or confirmed cases affecting them. We'll trace their close contact, put them under quarantine. Yeah. Okay.
So, as I said, the number of cases increased gradually. From yesterday, there are 300 cases. Now there are 600 cases, and we expect there will be more cases coming in a few days. But we consider this is some effect after the holiday events and clusters. So hopefully, with all the social distancing measures, and we still appeal to members of public not to gather, stay home. So we hope with these measures and also our current containment measures, we hope we can still contain the disease.
Okay.
Next question, please. A lady in front, please. Phoenix TV, a couple of questions, if I may. There are some suggestions that the seriousness of the pandemic is due to the low vaccination. What is the vaccine coverage at the moment? And with regard to Omicron, for the confirmed patients, what is the ratio between the various types of vaccination? And you are the experts on the front line for the Policy Bureau. When they formulate the policies, what sort of areas should they pay particular attention to reverse the seriousness of the situation? And also, there are some frontline healthcare workers who got infected. That the HA said there are enough PPEs. Why is it that there are still infection on the front line? What measures do you have up the sleeve to tackle this problem? Also, horizontal and vertical transmissions are happening increasingly. Are there any measures in Hong Kong to examine the plumbing, the piping of the buildings, so that they are not suitable for home isolation? Right. In terms of policy, I'll let you say something first, and then Dr. Lee can say something about the hospital, and Dr. Chuang can supplement. In terms of policies, we are adopting this containment policy. A couple of months ago, when the Omicron variant emerged, we became vigilant because it is highly transmissible. We were very concerned that it was at the end of the fourth wave. We were very concerned about the emergence of a fifth wave. So we geared up ourselves to guard against the fifth wave. So we guard against the importation of cases. We try to keep out the cases in Hong Kong. So for a couple of months, this policy has achieved tangible results. When cases came in with the transmissibility of Omicron, as we can see, we have to keep up with the transmission. In this present fifth wave, at the very beginning, we very quickly adopted a proactive measure. At the very beginning of this wave, we adopted thorough social distancing measures, and we suspended classes in order to minimize the gathering of people and to keep on top of the COVID variant. During the Lunar New Year, we saw a lot of gatherings, and in this wave, I think mostly it is because of the festive gatherings that caused so many cases. I urge the public to cooperate with us, notwithstanding the number standing at 600. We would anticipate more tomorrow because we've seen quite a lot of preliminary positive cases. So please do not give up. We have to pull in the same direction. We have to monitor and observe the social distancing measures. For vaccination, for about a year, on various occasions, we have been reminding the members of the public the importance of getting inoculated. There was some misunderstanding somewhere along the line about the undesirable impact of vaccination. We reminded members of the public that getting the jab will stand them in good stead. The people, some of them, are adopting a wait-and-see attitude. When the COVID situation is stable, they don't think that there was high risk and they didn't go get tested. But in the fifth wave, the number has been increasing dramatically. Then for those with the first shot, the percentage is 80%. And I hope that for those who haven't quite got vaccinated, please go get vaccinated. We are more concerned about the elderly population. The vaccine coverage is 80% now, but for the elderly population, it is still on the low side. So we are taking various measures, like in the elderly segment, we are encouraging them to get inoculated. In particular, the family members, some elders would like to get the jab, but the family members would dissuade them to do so. Now we have to bear in mind that COVID is very detrimental to the senior citizens. The HA colleagues have talked about some serious cases involving senior citizens. Now, if you have elderly people at home or in the old folks' home, please remind them to get vaccinated as soon as possible. I defer to Dr. Lee about the HA.
I already mentioned that altogether we have 17 colleagues who have been preliminarily confirmed because of community or household contacts. I think you need to pay attention to 2 points. First of all, we have more than 20 colleagues who are classified as close contacts. But since they've all worn proper PPE, so we don't have a single patient who has been defined as close contacts. For the 200-odd staff, they are working mostly in the 4 hospitals, and while they have been preliminarily confirmed due to community or household contacts, there have not been any close contacts that we have been able to trace. So if of course we believe that while they were taking the rest, they might have let off the guard. That's why we are reminding our colleagues again not to do that. Since the 31st of December, according to our understanding of the confirmed cases, 58% of the cases have taken more than 2 shots. For those over 12, it's about 60%. Lady at the front. Sorry, the speaker's not coming through. If I may supplement here, we have seen a lot of vertical and horizontal transmission in buildings. We've seen that for some of the cases, it could be that they have actually reconfigured the pipes in the premises and thus causing the transmission. For most of the units, the U-traps have not been filled with water. So when they switch on the exhaust fan, the virus could come into the premises. For many of these cases, there's no problem with the pipes, but rather the Omicron variant can spread very quickly. So it could be transmitted through the air, or what we call a chimney effect. When you have hot air going up, and when people open the door, the air will rush into the premises. So basically, it's because the virus is highly transmissible, and that's why the transmission is relatively more difficult to avoid. In our investigation this time, we found that we've also raised this issue with the property manager of the buildings concerned. Cable TV, my name is Tam. Now this morning, Professor Kwok of the Chinese University said that the number of confirmed cases could likely reach 1,000. Does the Department of Health agree with that assessment? Or is it that 1,000 is not yet the tip, and when are we going to see the peak in terms of numbers? And secondly, regarding contact tracing, are you lagging behind, and by how much are you lagging behind? How many people are still waiting at home to be taken to the hospital or quarantine center? And for Hing Tai House in Twin Moon, from 10:20 this morning, the police received report that a 70-odd elderly person died at the premises. He's confirmed dead. Does the Department of Health know anything about this case because the building concern is subject to lockdown. Have you tried to find out how many singleton elderly people are living in these units? How can you ensure that elderly persons living alone that their health will be taken care of? Thirdly, this is for the HA. Dr. Zhang in the radio program said that if you take the rapid antigen test at home and you are tested positive, you should avoid taking crowded public transport going to the hospital. So which forms of public transport are not suitable? Should they walk to the hospital or take a taxi? If they take a taxi, the taxi driver will also need to be quarantined? What suggestions do you have for members of the public as to how they might go to the A&E ward in such a situation? And also, when someone is tested positive, the family members can go collect bottles to collect his, deep throat saliva, specimen. So what precautions would you advise they should take, such as how they can wrap these specimen bottles, or is it possible that when you require these people to take the RAT, you also give them, a bottle for the collection of the deep throat saliva specimen? Let me answer the several questions regarding our assessment of the epidemic and our contact tracing. And Dr. Lee will answer the question relating to the hospitals, and Dr. Zhang will talk about the cases. It is difficult to predict what's going to happen going forward. We are adopting a lot of containment measures. Now, we are confident that the public will cooperate with us. We have many suggestions, and if the member public could avoid, social gathering to contain the spread of the disease. Looking at the trend in the last few days, we have 300 cases yesterday, we have 600 today. The number of preliminary positive cases today is more than 600. So it's likely that tomorrow the number would be close to 600, 700 or 800. I hope, although the number is increasing in the last few days, that doesn't mean that we don't have the ability to contain the epidemic. Other than our contact tracing work, cooperation on the public is also very important in helping to curb the transmission. If the public could refrain from, social gathering and stay at home, that would be an effective way to actually cut the transmission chain. As for contact tracing, we're under a lot of pressure because although we now have 2 contact tracing officers, we hope there will be a third one to be set up soon. We have more manpower, but the workload, the pressure coming from the workload is also higher. But we need to actually catch up with the rising number of cases. In our contact tracing, we rely very much on the cases concerned as to remember where they have been. Say, for example, the Leave Home Safe app can help us in this regard, but we are seeing more cases, and after we've deployed more manpower, we hope we'll be able to conduct the tracing more quickly. On delivery of the patients to the hospital, there is a pressure here. The number of beds in the hospital is also in a very tight situation. If there are 600 cases, suddenly we are under pressure. But starting tomorrow, we will be starting the community isolation facility so that we have more, place to take the patients to, and that can certainly help provide some relief for us.
Well, you mentioned that if the RAT test positive, how should they go to the A&E? Now, we would advise that people go there by their own vehicle, or they go there by taxi. But the key thing is to go there by designated transport. They shouldn't be branch off to anywhere else. Indeed, there is an element of risk, but we have to assess the situation. So if there are family members who can render assistance and provide or hand over the deep throat saliva test, it would be a desirable situation. And it is the same as the other infection control measures. Now, for deep throat saliva test, we need to have the deep throat saliva instead of just any saliva from the mouth, and you have to tighten the cap and put it into a bag. And the key thing is the hand hygiene before and after the test. You asked me whether one should wear the gloves. I think either way it would be okay, as long as one observes good hand hygiene. Now, whether you should wrap it up in many layers, and I think it would, in a way, contaminate the specimen. And I think you just observe the way we deal with the specimen. A lady's not speaking through. Well, this is all a matter of risk assessment. If the family members are observing the risk control measures, I'm sure they can do it. Dr. Chuang, I don't have any details regarding in your case. Let me supplement, beg your pardon. We've seen more community cases, and some of them the positive result came from the RAT, and that they would go to the doctor by whatever means of transport. Now, if there are many cases in the community, the risk will be higher as a result. So I am at pains to remind people not to go out unless absolutely necessary because of the sheer number of cases. If you have to go out, you have to wear your mask properly. According to some literature, if there are two people there and if both are wearing the mask properly, the risk of transmission would be lower, much lower. And in some cases, we see people not wearing the mask properly. In particular, when it comes to Omicron, it is more airborne, so you have to wear a face mask, which is a proper fit. So during these extraordinary times, if you have to go out and if you're worried about getting infected, you have to find the face mask, which is really a good fit for you. And this is critically important. When you go out and about, you have to listen to Dr. Lee. You have to observe hand hygiene, all the protocol, and so on. So once again, the risk of infection in the community is high, so stay at home unless absolutely necessary. Don't go out unless absolutely necessary. RTHK, Tuen Mun Leung King Estate, Leung Kit Leung Ling House. Why don't you put them on lockdown? Are there many cases there? This is for the HA. Are there any RAT positive cases that are turning up at the A&E? How many cases are there in this category? And for the A&E, now for these kind of positive patients, how are you going to triage them? Will they be aggravating the burden of the A&E? Do you have sufficient manpower to make sure that you can triage these positive patients? Also, home isolation, aren't you worried about the transmission? What about the trash? Are you going to be segregating the refuse coming out of these households? Let me say something about this Stay Home Safe home isolation program first. Now, for the home isolation program compared with the quarantine facilities, and there is a high element of risk for sure, but during these extraordinary times, we have to reserve the facilities to those who are of higher risk, meaning the positive patients. We have to strike a balance there. Now, for these home isolation program, with the cooperation of the public, we can minimize the risk. We do have the information kits, like when they take out the trash, and they have to tie up the trash bag, and they have to keep the time staying out as short as possible. Now, these people are not positive patients, they are subject to isolation for 4 days or 14 days. They are not positive patients. But if they do have symptoms, they should notify us for them to be sent to the hospital for further examination. If they test positive, if they have any symptoms, we will send them to the hospital. Now, this is the way we are trying to minimize the risk arising from the home isolation program. Dr. Lee. Right, these rapid antigen test, we have seen some positive patients arising from this at the A&E, although I don't have the precise number. When they turn up at the A&E, we will not be seated with all the A&E patients. They will be segregated. They will be arranged to go to the outdoor triage and test station for testing. If they test positive, they will be hospitalized. Now, I don't deny that the current situation is creating some pressure on the A&E departments, but our colleagues at A&E are very professional, and if the waiting time is a bit longer, please bear with us, please. Lung Kit House, my understanding is some testing will be going on. Next, please. Lung Kit House, there are more cases there, and there is also a vertical transmission. So we have colleagues looking at this to see whether there are any further cases yet to be identified.
From the RTHK, some medical experts said Hong Kong might see 1,000 or even 10,000 COVID cases if figures continue to surge. What's your estimate about cases per day in the coming future? Another question is for Dr. Lee. Hospitals now running out of capacity, and that's why you're sending patients to Penny's Bay. And how will you ensure the patients will receive appropriate care in there? Also, the HA urged those tested positive with a rapid test to go A&E for retesting. So will it cause further infection risk during their transportation? Thank you.
Okay. So I think a response to your question about the estimation of cases in the coming few days, and then I would like Dr. Lee to respond to the issue about hospital authority. So there are about 300 cases yesterday, and today there are 600 cases. So we estimate that the cases number may increase in coming few days. Probably the reason of the increase in this case is the effect of the gathering activities during the Lunar New Year festive. So, we can't be sure that we may reach 1,000 cases or more in coming few days, because we are still implementing a containment strategies, and we always appeal to member of the public to reduce the gatherings and also to avoid leaving home. So with these containment measures and the cooperations of the peoples in Hong Kong, we hope we can contain the disease. And we learned from the overseas experience where they do not have any containment strategies, the case may have exponential increase. But in Hong Kong, we have sort of containment strategies, and also the cooperation of people in Hong Kong. We hope we can contain the disease in the fifth wave now. So Dr. Lee, please.
Okay. According to your questions on the Penny Bay, I think we'll try to stratify the risk in terms of two things. Firstly, the selection of the cases. So we aim to select cases who are relatively young, asymptomatic or mildly symptomatic, and also without any major medical background, to be staying in Penny Bay Isolation Center. And on the other hand, we also focus on the management protocol. We try to get the patients to staying in an individual room of the Penny Bay Isolation Center. And we will have a protocol to manage such patients. For example, they will have a deep-throat saliva investigation on specific date. And also, there will be offered a hotline and also a choice to see a doctor while a teleconsultations, that the doctors and the nurses will be on site. As for the rapid antigen test, as mentioned before, the travel the target will be point to point and also designated. And we will advise the citizen will have a appropriate infection control, particularly the mask. We need a well-fit mask and for our patients to travel. And I think this is what I'm going to say.
下一題，隔離嗰位男士。
Gentlemen, over there, Hong Kong 01. Several questions. First of all, regarding home quarantine. You mentioned the 4-day and 14-day quarantine. For the close contacts, do they have to stay at home for quarantine for 4 or 14 days? And secondly, in the Chung Kwan O Integrated Rehab Center, do we have a case of a staff being infected there? Because there are many, disabled, residents living in that home. And thirdly, we've received some requests for assistance from our readers. That is, yesterday they were arranged to go to the charge station at the PWH, but they have waited throughout the night and they were yet to be admitted. At the scene, many of them have to spend, the whole evening in the cold. Some of the people who couldn't afford wait any longer and left. So could you clarify, exactly what happened? Would that really pose a risk? First of all, I'll answer the question regarding the 4-day or 14-day quarantine, and Dr. Lee will answer the question regarding hospital. Dr. Chung will talk about the cases. In our quarantine work for close contacts, in the past we would stipulate a 21-day quarantine. Earlier, we've studied the characteristics of the Omicron variant, and we've cut it down to 14 days. During the previous waves of the epidemic, we have learned that if we could also, trace the family context of the close contacts, we can, more effectively contain the spread of the transmission. The so-called, secondary close contacts, we want to be able to, trace them as soon as possible. Since they are secondary close contacts, they pose a relatively lower risk. And that's why we never impose a 14-day quarantine requirement for these secondary close contacts. During the 4 days, we would ensure that these people are not infected, that they are tested negative. And secondly, they also have a close contact. We're talking the first layer and the second layer. For the first layer, that is namely the first contact, after the end of the 4-day quarantine, we have to ensure that the close contact is also tested negative before we have confidence in the secondary close contact. If the close contact is found to be positive, then the secondary positive will become a close contact and he will have to be subject to a 14-day quarantine. So as for the household quarantine requirement, we will adopt the same, rule. You talk about A&E ward at the PWH. We don't have the full details so far. I'll keep you updated later. On the question of the patient taking a long time before being admitted, well, we do have a large number of cases. Indeed, the waiting time is longer for admission. That's why I said that if circumstances allow, we hope that the case concerned would have their family members or friends to help them deliver a deep throat saliva specimen for us, and if it's tested positive, we will still recommend them to rest at home. Now, we do have staff at elderly care homes and home for the disabled who have been confirmed positive. I've just heard that the Kwok Lo Fai Chan elderly care home in Sheung Wan, 2 elderly residents have been preliminarily confirmed positive. It's likely that some of the staff have been tested positive through the rapid antigen test. So 77 residents are now classified as close contacts and have to be subject to quarantine. Regarding the Chung Kwan O case, I'll need to follow up on that. Last question. Gentleman in glasses, AM 730. you said that you will be, doing away with the daily, fact sheet. So how can the public know about the name of the buildings and the numbers in terms of the shots taken? If you don't provide, transparent information, that would the public not be kept in the dark? For household quarantine, would the residents of the other units in the same building need to know that that there are people subject to such household quarantine in the building? And for the 4-day and 14-day quarantine, could you clarify that further? And also for the waste or garbage disposal of, do they have to be treated like medical waste? And thirdly, at the collection center, there have been long queues in the last few days. Is it possible the government to increase the capacity to collect specimen, or minimize or reduce the number of compulsory, collection of specimen or testing? Or would you use the collection of, collecting deep throat saliva specimen to replace, the taking of swabs? I'll answer the question regarding household quarantine first of all. When we conduct household quarantine, we will try to be as transparent as we can. As in the past, for buildings in which you have residents subject to household quarantine, we will certainly, provide the necessary information on the government, website, because that would be more transparent. And it would also help the property management agency know that they don't need to worry too much if there are people in the building subject to quarantine, because these are people who are being quarantined. But they would need to pay attention and conduct proper cleansing and disinfection of the building. Although we have a serious epidemic wave, now if you know that someone is being quarantined in the building, of course people should be vigilant or careful. But we will not disclose the exact unit where the case concerned is being quarantined, for the protection of privacy. So as for the disposal of garbage, if the case concerned is a person who is under quarantine, so long as they deal with the dispose of the garbage in a proper routine manner, it will do. Namely, that they should wrap up the garbage properly, and they should not scatter the garbage around. The garbage should be properly wrapped, and when he leaves the premises, they shouldn't take too long, because during that period they may be in direct contact with others, thus causing transmission. But it would depend on cooperation on part of the people concerned, because different people live in the same building. We hope that people who are under household quarantine would also work with us, that when you go out to dispose of your garbage, you should have to be tested negative after taking the RAT to ensure that you pose a low risk. Put on a proper mask and stay outside the premises for as short a period as possible. And do not open wide your door. And when you go out to dispose of the garbage, close the door first, and then when you return, you can close it again. The waste, however, could be treated like ordinary garbage. It shouldn't be treated like medical waste.
Right. If we're talking about the same building, we will not make the announcement. If there are new buildings, we will make the announcement on the web, although we may not be able to do so on the same day. As to the vaccination coverage, we would provide the proportion, the ratio, and so on. Right, the specimen collection stations. Now, there are more places that are affected with the number of cases. We'll have to let the public know which areas are of high risk so that they can go for voluntary testing. The pressure is severe, and we'd like to increase our testing capacity. As we said, we are ramping up from 100,000 to 200,000 per day. As to densely populated places, the members of the public may have to wait a little bit longer. Later on, we will be having a look at the situation and see whether we can adjust the number of days to provide a bigger window for the public to go get tested. Let's say once every 3 days, and then the next also once every 3 days, in order to do something about the waiting time. We'd like to the public to go get tested because we want to ascertain whether people are infected, and with Omicron the symptoms may be mild. There are some patients who may suffer from sore throat and upper respiratory tract symptoms. Now, if you suffer from these kind of symptoms, sore throat or minor fever, please do not take it lightly. You should go seek medical attention as soon as possible. Speaker not speaking through. As the swabbing and the testing are going hand in hand. We like to aim at 200,000, and we can swab 200,000 and also test 200,000. That's it for today. Thank you all very much.